It's not just the physical needs of patients and families with which doctors are dealing during the global pandemic. Psychiatrists and behavioral health experts are also deeply involved in providing care. These mental health professionals are a necessary source of help and consolation to the many people suffering from anxiety, depression, loneliness, and fear resulting from COVID-19. On this week's Health Talk, we'll introduce you to a psychiatrist who is on the front lines of providing comfort and coping mechanisms to those suffering with COVID-19 related mental problems. So stay tuned to this Health Talk on an important problem that affects us all. We're up next. Hello, I'm Dr. Eric Mazur. Today we're going to discuss mental health issues during the global pandemic of 2020. Joining me is Dr. Katherine or Tate Michael. She's Vice Chair of the Department of Psychiatry at Norwell Hospital. Friend of mine. Welcome back to Health Talk, Tate. It's so good to have you.
Thank you so much. It's good to be back.
This is a strange time. 2020, this pandemic has been with us for many months. I think the unspoken victims of this are not just those who get the disease, but the way it's affected us all. Tell us a little bit about what you as a health professional, as a psychiatrist, really see as the problems that we're all facing during this pandemic.
Well, you're right. It's a very, very strange time. It's a very difficult time. And, the problems, I think the main ones can be kind of broken down. You think about isolation is a huge problem for people. So on the one hand, you have people who are isolated. It tends to be worse for teens and older adults. And then on the other hand, you have people who don't have any time alone anymore. So it's kind of a one end of an extreme.
By time alone, you mean mothers who have their children home all the time, or people that are normally working outside the home were thrust together with their spouse or significant other all the time?
Exactly. So mothers who may have their own jobs, but they can't, they have to be at home and they have to be homeschooling, they have to be managing their kids and their jobs at the same time. So it's a huge challenge.
Maybe we could break this down into at least two groups: people who are predisposed to problems like loneliness or depression or anxiety, and then those people who've never had problems with it before but are suddenly facing something they've never faced. So what is this doing to people that are normally, I shouldn't say normally having coping problems, but those of us who do struggle with, for one reason or another, with depression or other mental health challenges?
I think that's a really good question. It's a good way to think about it. So if you do have a group of people who already have, a known issue, there can be more barriers now to getting the care that they need. We have been able to do a lot with telehealth, but still some of those barriers exist. And especially if people have lost their jobs, they may have lost their insurance, and so they have less access than they used to have. They may have more difficulty getting their medications. And a lot of people really do respond to that in-person social network. We can't have in-person group therapy anymore, so it's all by Zoom.
Think about that. So
right.
Groups are such a powerful tool. And
right.
Do you ever do that on a Zoom or try to do a group virtually, or does that?
Actually, we do, and we have been able to move a lot of our group work, all of it actually, to Zoom. And so I think for a lot of people that does work, if they can manage the technology and if they have the technology. For other people, it's a little more difficult.
Yeah, I can't imagine knowing the stress that this causes, to everyone, this added stress in so many ways, and then having to be trying to cope with some endogenous problem on top of it. I can't imagine coping with two together. How do you help people in this situation? What do you tell them?
Well, I think it's important, and we're thinking about sort of our two different populations. For the people who already have issues, they have to really make an effort to maintain their treatment, whether it's staying on their medications, whether it's being in touch with their doctors, whether it's being involved in a group. They have to make sure they do that, and then they have to make sure that they're really engaging their coping skills. So, maintaining daytime structure, getting up, showering, getting dressed, doing the things that they might normally do. If being in touch with someone socially helps, then they need to do that. Exercise, nutrition, sleep, all of these things are really important.
Are you seeing more acute decompensations? And for people at home, we worry about suicides in this situation, an increase in suicides, not directly from I shouldn't say because of COVID-19, but not infected with COVID-19. Are you seeing people, are you seeing those struggles out in your practice, out in the real world?
We are seeing that, and very sadly, we are seeing that a lot of youth, teens and youth, are really struggling. And it's such a time for them to grow socially and to begin to learn how to make connections, that this is a very challenging time for them.
Maybe earlier today I was discussing this exact issue. I have grandchildren who are both beginning kindergarten and just about to enter high school, and I certainly remember those times for myself. Even though I'm 71, I still remember the first day of kindergarten. I can't imagine going through high school, graduation, junior prom, starting college, and having to do that either virtually or part-time or from the dorm, and not being able to have those social interactions. You tell us a little bit more about that, because it does seem like such an important developmental experience that we all have that's basically being denied to our children.
That's right. That's right, and I think they're really struggling with the inability to connect with other people, and that many of them, the ones that I've seen, are thinking, what's really the point of doing it? What's the point of school? I'm just sitting, on Zoom, and it's I don't understand what the point is. And I think as adults we have a broader perspective. We can understand that this is time limited. It will, we'll get through this. We'll get over this. We'll get out the other side. And I think when younger folks have a different perspective, and they have a harder time seeing that.
Well, I know time does go much more slowly when you're 16, or when you're 15, waiting to get your license.
Right.
than it does when you're 55. It's such a different. I guess your life changes so much from year to year. When you're young, there's so many milestones, whereas 55 and 57 and 48 are pretty much the same.
Right.
So I just can't imagine. So are you seeing more teenagers? Are there programs being developed for teenagers? How do we handle, I actually shouldn't just say teenagers. I watched my little kindergartners struggle. Virtual learning is not conducive to a 6-year-old.
That's right. I mean, it's very
We could go the whole age range. Maybe start with the very young. I don't know how many.
Yeah, I mean, I think for the very young, it's probably not quite as bad. They've got family home. Maybe the family's got a new dog. I mean, so it's clustered around home. I think when they begin to get early school age, it's a big challenge, because trying to get a 5, 6, 7-year-old to maintain focus on an iPad for hours is not really.
It just doesn't happen. It just doesn't happen.
Right.
It's just not. But it seems like also, I think of kindergarten and first grade as much about learning social skills, learning how to control yourself in a classroom, learning sort of civilized behavior in a group, as much as learning your letters. And
that's right.
And you lose the first half of that in a virtual situation.
Absolutely, absolutely. And even you and I were talking earlier about how we feel kind of cut off. And think about a younger kid who's cut off from these friends that they've just made. And so that social connection piece, it really can't be replaced by Zoom so well.
Yeah, and then moving on to, I mean, again, the teenagers, the kids in middle school and high school. What are you seeing there?
We're seeing actually, we're seeing more kids come into the emergency department with, feeling kind of desperate, feeling very alone. Some of them feeling suicidal. And so, we're all very alarmed to see that. And one of the challenges in Connecticut and actually throughout the country is finding inpatient hospital beds for children, for people who are under 18.
Let me ask you a difficult question. Do you think that the stress of COVID-19 is actually bringing out subclinical tendencies towards depression or other mental illness? I mean, are we creating more very sick people rather than people that are just can normally cope but are struggling, but we'll get through it? I don't know if I asked that very well, but are we, in addition to people that would otherwise be recognized as having mental health challenges, are we creating new ones because of so much stress at such an inopportune time?
I think that probably that is happening. And one of the things we think about in terms of psychiatry is what causes depression to happen. And the model is really that maybe someone may be predisposed, and then a certain amount of stress is added, and then they become depressed, or they develop some other mental illness. And I think what we're going to find with this particular intensity of stress over the past, 10 months now, that is beginning to happen.
So we may have a residua of mental illness in this country even once the COVID-19 pandemic is over.
We may see that. We may see that. It also speaks really to the importance of prevention. Just like we take care of our physical health, we need to do preventive measures for our mental health as well.
And I know we're going to talk about that, but just what do kids find a substitute for the? Let me ask it more directly. All the social media that's available today, is that a good substitute for getting together with your friends afterwards, or is it potentially destructive in and of itself? I don't know where it falls out.
It's very mixed. It's very mixed. There are studies that show that the more a young person is on social media, the more anxious they are. So
is that a chicken or egg phenomenon?
It's a little hard to tell. It's a little hard to tell. I would say, you kind of have to judge with the kid, and that is if they are spending hours and hours on social media and coming away from that feeling worse or more depressed or more anxious, they need to take a step back from that.
And we've got 2.5 minutes left or so, Tate. I think one of the important questions is, for all these people out there, all of us, when's the threshold to get help? Where do we draw the lines as to when do we know things are beginning to go south and we really need to draw on somebody outside of ourselves?
Right. It's a good question. We all go through ups and downs, and in those downs, sometimes it feels like kind of the end of the world, but then the next day we're feeling a little better and we're feeling okay again. When we need to get concerned is when the downs are just persisting and can get to a very dark place where people begin to think of harming themselves and they begin to make plans about harming themselves. Then we get worried, and then we want to have that person come in to be evaluated.
Yeah, so this is really important, I think, for everybody. So it's when you begin to not ever feel joy.
Right.
Is that right? So
that's right.
You're feeling depressed all the time. Is suicide necessarily part of depression, or because I know we've always used this as internists. Have you thought about harming yourself? Have you made plans? That's sort of the simplistic way of deciding whether someone's dangerous. But it seems there's more subtlety than that. Maybe what are the other? Tell us a little bit more about beyond that.
Yeah, suicide isn't, it isn't always a manifestation of depression, and actually a lot of times people who actually do end up killing themselves, it can be a very impulsive thing. It's not uncommon for people to think about it. That's not uncommon, but when people begin to perseverate and can't get it out of their mind and begin to make plans and begin to take steps toward doing it, then we're very concerned.
And how about if I have a loved one, what should I be looking for in one part of my family, right, to begin to worry about them?
Well, what you were saying earlier, the loss of interest, the loss of joy, the inability to kind of feel good, persisting day after day, then we would be concerned.
Anhedonia, is that
yes,
the term?
Yeah.
Unfortunately, that's all we have time for. This is such an important topic. I wish we could speak more. If you have any questions, please email your questions and comments to me at healthtalk@newvanshealth.org. We'd love to hear from you. I'd like to thank my guest, Dr. Tate Michael, for joining me on Health Talk today, and thank you for watching Health Talk. We'll see you next time.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100.
and I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself. I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
The global COVID-19 pandemic has affected all of us in many different ways. It has caused great sadness in families who have suffered a loss, tension among loved ones, loneliness in those who live alone, and fear and uncertainty among virtually everyone. A well-respected psychiatrist will join us on Health Talk today to discuss coping strategies during this pandemic. Stay tuned for an important show. Health Talk is up next. Hello, I'm Dr. Eric Mazer. Today we're going to discuss personal coping strategies during the COVID-19 global pandemic. Our guest is Dr. Katherine Michael. She's the Vice Chair of the Department of Psychiatry at Nuvance Health, or Norwell Hospital. Welcome to Health Talk, Tate. It's so good to have you here. This is such a timely topic.
Thank you very much for having me. It's good to be back.
Everybody is really sick of COVID-19, literally and figuratively.
Yes.
I think none of us really anticipated it going this long. I think everybody feels some sense of stress, loss, disruption by this. Tell us about how can we appropriately, I won't say happily cope with it, but appropriately cope with this ongoing stress and uncertainty?
Well, that's a good question. I think humans, we're pretty good at dealing with things where we know there's an end point, so we can run marathons, we know how long things, here we don't know what the end point is going to be, and so it's a real challenge. So to the extent that we can structure ourselves and try to take back some control over what we're doing, that will help a lot.
So how do we do that?
It's a good question.
Because it seems like, especially with government mandates changing by the day. One day you're allowed to go to a restaurant, the next day you're not. I can't even imagine being a small business owner and being allowed to open up and close up like they do. How do you deal with this?
Yeah, I mean, so within your world and what you can do is structuring your days as much as possible. If you're working from home, structuring that day like you would be going to work, so that you're showering, you're dressing, you're getting
literally dressing, showering and dressing is a good thing to do.
Yeah, and then moving yourself to the area which you're going to work.
So you shouldn't be working from your bedroom in your pajamas. It sounds so comfortable, but it doesn't.
But ideally not. And the more we can add some structure, and the more that you can take agency over what's happening, I think the more empowered you're going to feel.
And how about when you are starting to feel blue or get angry? What are healthy outlets for that?
So,
or ways to deal with it?
Yeah, another good question. I think we talk about preventive care for physical health, and preventive care for mental health is just as important. So to do that, everyone has to kind of take stock of what works for them. So it might be exercise or any kind of movement or meditation or yoga is a very important thing. It might be taking up a new hobby, so knitting, whatever that might be. And so people really need to kind of check in with themselves to see what it is that works for them.
How do you overcome the inertia? I think the new hobby is an interesting one, something I've thought of myself, like playing piano or learning it. My sister, who is isolated, has taught herself the guitar.
Yeah.
But there is a certain inertia to getting going. Are there any tricks for that?
Tricks, small steps. So, just not overwhelming yourself with, I'm going to learn this in whatever period of time. But, just kind of venturing in. If you're going to take up the piano or an instrument, kind of approaching it and doing something that's very, very easy in the beginning. And then you kind of get drawn into it.
How about socially? We all sort of miss each other, miss family events, but also, for example, we moved into a new neighborhood and we've met people out walking that we like, but we have no way to get together. You know, we have no way to sort of pursue what would be a normal introduction to our neighbors.
Right.
What should we be doing? What can we do?
You know, that's a challenge, especially as we move into the winter. So in summertime, you know, you could go on a socially distant walk or have a picnic outside, you know, people kind of appropriately separated. It's harder to do in the wintertime, and so we have to be a little more creative. And we have to maybe kind of step outside ourselves and invite these people to maybe a Zoom.
Actually, one of our neighbors has set that up on Saturday nights, a Zoom conference every other Saturday where 3 or 4 couples get together.
Yeah.
And we've met a couple of couples that way that we haven't seen in person yet. So it's an interesting, it's not as nice as getting together, but
it's what we can do right now. And so, you know, knowing we've had some good news in the past week or so in terms of the vaccine, so knowing that, you know, okay, there may be some light at the end of the tunnel here.
Yeah, I was just going to ask you that question. There's uncertainty. There's a little bit more certainty now. We have an idea that at least there's a light at the end of the tunnel. Whether that light is in January or September, we're not sure yet. But how can we manipulate that so it does feel more comfortable?
Yeah, I'm sort of, for me, I'm telling myself, you know, summer.
So you sort of set that time for yourself.
Yeah, summertime, and you know, I'm hoping, and if nothing else, at least it'll be summer, and we can get back outside again.
Yeah, the outside is a big difference. I've felt I've always felt protected in an outside environment, and as you said, we're losing that to a large part. You know, I guess we can go skiing, but that everybody isn't going to be skiing. You can't see big social groups either. So.
Yeah.
So that's a tough one. How about again seeking help? When we all feel more anxiety now, we all feel more depression, we all feel a sense of loss, we all feel a sense of uncertainty. I don't think you'd be human if you didn't. When is it getting dangerous? When do we need to begin to say, hey, I need some help, extra help?
So that's a good question, and it's a continuum. So there are those of us who are, you know, struggling with the stresses, and they are large of what's happening now. And then there are those of us who have maybe a pre-existing condition, or maybe a new one that we didn't know about that's more concerning. So when, you know, if we take depression, for example, when people begin to be so depressed and so despondent that, you know, they have lost interest in everything, we would get concerned about that.
And where do they seek help?
So that's a good question. And, you know, if it's an emergent situation, then they need to come into the emergency room or call 911.
So that means if you're sitting there seriously ready to take those pills or ready to hurt yourself, that's an emergency.
Absolutely, right. And they need to come in, they need to be evaluated. There's a range of interventions in between. So there are warm lines and hotlines people can also access through 211 in Connecticut.
211.
211, right. And so they can contact, and there's mobile outreach as well. There's a state-sponsored program that can provide mobile outreach, also accessible through 211.
I've actually heard of that, but that's good to emphasize that because it is a source of all sorts of support, right. No matter what it is in this terrible situation. How do we maintain the contact with family members that's so important? And let me ask the converse question. We have family members spending more time together than they ever thought possible, and it's creating tension in families.
Right.
I mean, it's sort of the yin and the yang. They both don't work. How do we fix that? Or how do we deal with it? We're not going to fix it. How do we ameliorate it?
That's right. I've seen both sides of it. So I've seen, you know, there are a lot of family members in a very small space, and everyone's at home and school from home and work from home, and that can be very challenging. So, you know, really trying to focus on how to kind of eke out a little bit of space here and there for, you know, this is my space, this is where I'm going to be, I need some quiet. Doing that. And then the other side is people who are really disconnected from family, and thinking particularly about, you know, our parents, for example, who may be very isolated because it's too dangerous for them to really get out.
Yeah, this is a real problem with nursing homes. In our family, we have a family member who is in a nursing home, and we were seeing her by outdoor visits, but again, with the cold weather, that's becoming increasingly difficult, if not impossible, and there are no indoor visits.
Right.
And that, again, for some of the very old relatives, they don't fully understand what's going on. And then that creates guilt among the children because they feel that their parent doesn't know that they care still.
Right, right. And that's a big challenge. And I think, a lot of, my parents are elderly and they're in assisted living, so they have people around, but they can't really, interact with them. They are getting to where they can kind of use Zoom, but not so much. They're still good with the phone. So, we have to do what works for the individual.
So we're all just coping as best we can. How about medication? How often do you resort to medicines? Is this and do they help?
They do help. They do help. And I would say for people who were on medication before all of this, obviously they should stay on that. This is not the time to try to experiment.
I was just going to say, this is the time to try to see whether you can stop your antidepressant. That's
right. That's right. So recommend staying on it, staying in treatment, staying connected with your providers, staying connected with groups if you have those going on. And then for people who have, new conditions emerging, medications they're always a consideration. Personally, I like to try to see if, other interventions would also work. So there's a lot of telehealth therapy going on, and people
I think that's been a really
a
silver lining in healthcare delivery, because it's really accelerated telehealth. I've had a telehealth visit with my doctor not too long ago. It was very pleasant. We had a lot of face-to-face time. So this is really now what makes it widely available.
It is widely available, and it's really nice. And I think those of us on the provider side of this are really going to be advocating that insurance companies continue to make this available. And I would take it a step further. We've also been able to do telephone visits with people. A lot of people may not have a computer or an iPad or have access to that. So being able to connect with folks by phone has been very helpful.
Yeah, and that's something that was always sort of under-recognized in healthcare, as I think we all delivered a lot of care in one way or the other over the phone, but it was always considered off the books, and it was undervalued. Not so much as income to me, but it never got quantitated as work among the people that were providing it, and it can be very, very useful. Advice to people at home?
Well, I would say, make a list. I'm a list person, so make a list.
You and my wife would get along great.
Make a list of the things that work for you, and when you come up with that list, then try to put that into a structure, and then try to adhere to it. Me personally, I try to do something active every day, and that is frankly more of a mental health thing than it is a physical health thing.
And it doesn't have to be running a marathon.
No.
You can walk around the block.
Exactly. Just kind of get yourself outside, or whatever it is that works for you. My daughter does, she does yoga on the.
I didn't want to miss yoga because we've got only a minute left. But yoga, I've seen so many people are using yoga, and especially breathing. I see that now talked over and over again. I've used that myself. I think it's a wonderful anxiety reliever. Just say 2 words about that.
I think it's a great anxiety reliever. And before we end, I would say that a lot of people are experiencing some problems with sleep, and to the extent that they can really kind of manage their anxiety and sort of settle down and center, and if meditation is your thing, absolutely.
So this is not necessarily a far out Eastern religion kind of thing, and I don't mean to say Eastern religions are far out, but what I was thinking of when we were teenagers, this is very effective, meaningful, evidence-based self-therapy.
Absolutely, and it does work.
And it's not very complicated either. You can find lots of places on the internet that tell you lots of techniques, and they're worth trying.
That's right.
That's great. Thank you so much. And once again, unfortunately, we've run out of time. Please email us your questions and comments. You'll mail them to healthtalk@newvancehealth.org. We'd love to hear from you. I'd like to thank my guest today, Dr. Katherine or Tate Michael, for joining me on Health Talk and providing such important information. And thank you for watching.